Yes, thank you, Meg. Good morning, everybody. So next, to talk about the current state and future of MCH in Arizona, we have two presenters. I'm thrilled to reintroduce to you Patercia Tarrago, Bureau Chief for the Bureau of Women's and Children's Health at Arizona Department of Health Services. As Bureau Chief, she serves as Title V Maternal and Child Health Director for the state of Arizona. In that role, she oversees the following offices: women's health, children's health, which includes children with special healthcare needs, oral health, primary care, and the Office of Assessment and Evaluation. Patercia has over 25 years of direct service, program development, and leadership experience in the public health arena, focusing on improving access to care for rural and underserved communities. With a passion for maternal and child health, most recently, she provided leadership on launching a statewide maternal health initiative aimed at reducing maternal mortality and severe maternal mortality. Please join me in welcoming Bureau Chief Tarrago. Also thrilled to have with us today Martin Celaya. He currently serves as the chief for the Office of Assessment and Evaluation and leads all evaluation and epidemiological efforts for the Bureau of Women's and Children's Health. Mr. Celaya has over 10 years of working experience at local, state, and federal public health from the U.S. Centers for Disease Control and Prevention. Mr. Celaya's skill and knowledge include a deep understanding of program design, program evaluation theory, concept and techniques, high data analytical ability, and understanding of statistical software packages commonly used in public health. Mr. Celaya has an MPH from the University of Arizona and is currently a doctoral public health student in maternal and child health at University of Arizona. Welcome, Martin and Patercia. Thank you for being here.
Thank you so much. I apologize for that short delay. So first of all, I just want to thank Carolyn for that comprehensive presentation on the history of Title V maternal and child health, and really how it's evolved over the course of time over the past 85 years. And Liz, thank you so much for that warm introduction. It's a real pleasure to be here today. Before I get started, I want to recognize the staff from the Bureau of Women's and Children's Health with the Arizona Department of Health Services. Some of the staff will be sharing abstract presentations. As mentioned, Martin Celaya will be joining me to share statewide needs assessment information. And then I also want to just thank staff that have assisted me in preparing today's presentation. Tomorrow, you all will have the pleasure of meeting our fantastic family advisors, Miss Edie Smith and Miss Dawn Bailey. Thank you so much to both of them for sharing their life experiences, their voice, and guiding us in helping us stay grounded and connected with the families and children with special healthcare needs here in Arizona. Also want to let you all know that Dawn Bailey also serves on the MCH National Board as a family representative. So Arizona has a lot of work cut out for us, but we have excellent representatives at the table. As many of you know, the Title V Maternal and Child Health Program is vast, and if I had the time, I could easily spend a month on all of the dynamic components of the program. Today, I will provide an overview of the structure, a snapshot of each of the population domains that include maternal health, infant health, child health, children and youth with special healthcare needs, and adolescent health, all of which are bookmarked by access to care and oral health. The presentation also includes an overview of our Title V statewide needs assessment and findings. And then I will close with a quick view of what's ahead in the near future. Next slide. So just wanted to give you guys a quick picture of where the Arizona Department of Health Services resides. You will see here in this organizational chart that the Department of Health Services reports directly to the Office of the Governor, Governor Ducey. Our director is Dr. Kara Christ, and we are part of the executive branch of our state government. What I also wanted to highlight here is that the Arizona Department of Health Services has 3 primary divisions, which includes the Arizona State Hospital, Public Health Services, and Licensing Services under the Division of Public Health Services. And then the final division is the Division of Policy and Operations. What I wanted to highlight here is that the majority of our activities in response to the COVID-19 pandemic are occurring under the public health preparedness. That's where our vaccine rollout, testing, surveillance, et cetera, are all occurring. And then licensing, of course, is playing a critical role in assuring that our facilities that are providing ongoing medical services have the equipment that they need in order to keep staff and patients safe. And then the section that the Bureau of Women and Children's Health lies under is part of Public Health Prevention Services. And there's 3 bureaus located there. So I mentioned the Bureau of Women's and Children's Health. We also have the Bureau of Nutrition and Physical Activity, which includes WIC, SNAP Ed, and other activities that support families in the community. And then we have the Bureau of Chronic Disease and Health Promotion. And that's that bureau actually includes sexual violence prevention, for example, as one of the areas that they focus on. Next slide. So this is just a quick snapshot of how we're organized. You can see there that we have office chiefs for the Office of Women's Health, Children's Health, Oral Health, Primary Care. Martin there, you will see that he's over the Office of Assessment and Evaluation. And then we have a section focusing on business and finance. And I would be lost if it were not for the amazing administrative team that's available to me. And that includes Vanessa Davis and Allison Lucas. Our Bureau also has about 45 full-time staff that support the Title V Maternal and Child Health Block Grant efforts in Arizona. This next slide really is just to highlight the focus of our work. The mission of the Arizona Department of Health Services is to promote, protect, and improve the health and wellness of individuals and communities in Arizona. At the Bureau level, our vision is healthy women, healthy children, healthy tomorrow. This is what guides the Bureau's programmatic and strategic efforts. And then we are focused on our primary goals include reduce mortality and morbidity among women and children, eliminate health disparities in health outcomes and access to services, and increase access to healthcare, and applying our key values to the work that we do. And you can see there, our key values include service, partnership, integrity, teamwork, quality, diversity, accountability, flexibility, and a focus on community. Next slide. Thank you. So just real quick, Carolyn did touch on our budget in terms of how the funds get to the different states. And I just want to highlight here that with regards to the Title V Maternal and Child Health Block Grant, Arizona receives an annual award of about $7.8 million, and our state match is $12.3 million. And that brings our total funding for maternal and child health activities close to, or just a little over $20 million annually. The largest source of funds in our Bureau is the Maternal, Infant, Early Childhood Home Visiting Program, more commonly known as MCV. And you'll see there that those funds are basically just under $11 million annually. We also receive state non-appropriated funds that include state lottery dollars, emergency medical service funds for our Health Start home visiting program, teen pregnancy, and our state loan repayment programs. And then we also receive some state appropriated funds that include funding, for example, for the child fatality reviews, high-risk perinatal program, and some other operating funds. So this is just a quick snapshot of how the funds come into the Department of Health Services. Next slide. I'm going to transition over now into just providing an overview of the different programs that we have here in Arizona. Next slide. So just real quick, a little bit about Arizona. You all may be familiar with this information, but it's always good to stay grounded. So our current population is just over 2 million persons in the state of Arizona. We have the third highest rate of growth in the nation. Arizona, as you all know, if you haven't been out and about, we have 15 large counties, unlike a lot of the states back east that have very small counties. Arizona is also home to 22 federally recognized tribes. That includes the Navajo Nation, which is the largest American Indian tribe in the United States. And this graph shows that about 40% of our tribal population speak a native language at home. This chart also shows that 1 in 3 Arizonans, the diversity of our state continues to change. Next slide. So one of the factors that impacts access to care is insurance status. Many of us have employer-based insurance, and this slide shows uninsured children and adults between the ages of 19 and 64. The uninsured population decreased by about 500,000 in Arizona between 2013 and 2018. During that same period of time, an additional 538,000 individuals were enrolled in Access. Arizona currently has just over 2 million people enrolled in Access, many of which are women, infants, and children. While the uninsured population had dropped, it has been rising again, and we expect to see this trend continue in 2020 and 2021 due to job loss as a result of the pandemic. And I just wanted to remind everyone that the Affordable Care Act currently has an open enrollment period that goes through August 15th of 2021. And you can find more information on how to get insurance if you visit healthcare.gov. Next slide. So this slide is really looking at another challenge that we have here in Arizona, which is a shortage of clinicians or the distribution of clinicians in our state. Arizona currently has 644 health professional shortage areas. A health professional shortage area is a federal designation, and it is a standardized measure used nationwide that looks at the number of clinicians who serve populations at or below 200% of the federal poverty level in a given geographical area. Using federal criteria, a health professional shortage area designation is given for 3 disciplines that include primary care, dental, and mental health. So in order to eliminate these 644 health professional shortage areas in the state, Arizona needs 558 primary care physicians, 381 dentists, and 178 psychiatrists. I also want to let you know that we've recently completed a primary care needs assessment, and it's going to be up on the ADHS website very soon. Next slide. So in response to, I'm not going to go through every single one of these programs that are listed here, but in response to the high number of health professional shortage areas in our state, we offer a range of federal and state workforce incentive programs, such as the State Loan Repayment Program for primary care clinicians that includes doctors, nurses, nurse practitioners, physicians assistants, and pharmacists that work in outpatient settings in some instances in critical access hospitals and are located in a health professional shortage area. These sites must also accept Medicare and Medicaid assignment and offer services on a sliding discount fee for uninsured individuals and families. The State Loan Repayment Program is also available to dentists and mental health providers. One of the activities that we provide is technical assistance to clinicians and employers interested in participating in any of these programs. And we currently have over 500 clinicians participating in at least in any of these given programs, providing much needed service to low-income individuals and families. Additionally, during the pandemic, we updated a sliding fee scale clinic site on our webpage that identifies those sites that offer telehealth and telemedicine to support pandemic mitigation efforts. And this information is available online. There's an app that can be downloaded to help find the nearest sliding fee scale site for individuals in need of care. Next slide. So this is a snapshot of women and maternal health in Arizona, and this is a busy slide, and that's because there's a lot to say on the topic of maternal mortality and severe maternal morbidity. And I want to invite you to attend the abstract session later today to hear from our bureau expert, Ms. Clark Bear, on this topic and work. So very quickly, what I wanted to share here is that much like the rest of the United States, Arizona's maternal mortality rates continue to increase. Arizona is ranked 25th for maternal deaths in the nation. And in my opinion, one maternal death is one too many, and I'm sure that you all would agree. Unfortunately, maternal mortality and other complications that arise during and after and up to 1 year of post-pregnancy occur way too often in Arizona women, in particular among American Indian women and African American women in Arizona. I invite you to visit our website and read our most recent maternal mortality report, which was published in December of 2020, where we noted that each year in Arizona, approximately 70 women die within 1 year of pregnancy, of which 15 to 20 of those deaths are pregnancy related. In other words, they would have not died if that woman were not pregnant. Arizona reviews and reports on all deaths occurring within 365 days of pregnancy in the state, regardless of the manner of death, in an effort to identify and prevent other risks women face before, during, and after pregnancy. And so once again, I'm just going to encourage you to please attend Clark's presentation later today to learn more about the work that we're doing to address this issue. Next slide. This slide provides various programs focused on improving maternal health outcomes by leveraging the Title V block grant, initial planning and stakeholder initiatives to address maternal health in Arizona were able to be established. And I shared some of those efforts during my opening comments. In Arizona, we were also able to enhance support for the Pregnancy Risk Assessment Monitoring System, or PRAMS. We reestablished the Preconception Health Initiative, and as mentioned, the Maternal Mortality Review Program and Maternal Health Innovation Programming as well. And I also want to encourage you to attend Ms. Gina Herrera, who will be sharing an abstract on PRAMS a little later today. Next slide. This slide is a snapshot on infant health in Arizona. And you can see here that only 28% of families can afford infant care due to cost. I'm excited to hear that some discussion is happening at the legislative level to help support families with some of these costs for infant and child care. The graphic on the bottom there shows that we continue to see a rise in the number of infants born with neonatal abstinence syndrome. In 2019, there were 805 infant borns with suspected or confirmed neonatal abstinence syndrome in Arizona. And then on the right there, you see the top leading causes of death. And later today, for infant death, and later today, you will hear from our child fatality review expert, Jessica Parafet, who's going to give an overview on the child fatality review process that we use here in Arizona. A lot of our focus is really going to take a look at this in this upcoming year at those 425 infants that died before their first birthday in 2019, in particular focusing in on suffocation. We know that a lot of families continue to co-sleep with infants, and that is leading to premature deaths. Next slide. So when we look at infant health, we see that Arizona has a rather robust system to address the needs of infants in the state. Substance exposed newborns basically indicates that substances are used by pregnant women and is a leading preventable cause of mental, physical, and psychological problems for infants and children, with alcohol being the leading preventable cause of intellectual disabilities. Our Bureau co-leads the Arizona statewide task force on preventing prenatal exposure to alcohol and other drugs, and is comprised of collaborative teams, including other state agencies. And we bring stakeholders together to look at how we can address this very specific issue. I also wanted to highlight some efforts that we have with regards to breastfeeding. We partner with the Bureau of Nutrition and Physical Activity on a number of activities to support breastfeeding. That includes professional development and opportunities such as the Latch Conference and lactation webinars and courses. We provide a 24-hour, 24/7 breastfeeding hotline to support women who are interested in breastfeeding, and provide that service 24/7, and it is in English and in Spanish. We also partner with the Maricopa Department of Public Health Services and developed a toolkit to support employers so that women who are returning to the workplace can have appropriate levels of support to breastfeed or support breastfeeding while at work. And it creates an opportunity to implement workplace policies that support breastfeeding. And then in partnership with McVie in 2019, we continue to provide support to individuals that are interested in pursuing their IBCLC certification as a way to promote and support breastfeeding in Arizona. Next slide. So this is a quick snapshot of children, of child health in Arizona. And you can see there that 3 out of 5 children with Medicaid or access insurance completed their 7 vaccines series. We also know that Arizona has a significant need with regards to addressing ACEs, or adverse childhood experiences. Arizona ranked 50th in the nation when it looked at children who have experienced 2 or more adverse childhood experiences. And then we know that almost 2 in 3 children in Arizona are affected by tooth decay. Tooth decay is the #1 chronic disease among children in Arizona. And tooth decay was 3 times higher among children with public insurance versus private insurance. And then that slide there, or the picture of the nation there, is looking at the number of children without insurance. And you can see that Arizona is higher than that of the nation. Next slide. So just taking a quick look at child health. Again, our largest program is the Maternal, Infant, and Early Childhood Home Visiting Program in Arizona. We utilize 4 evidence-based models, which includes Healthy Families, Nurse-Family Partnership, Parents as Teachers, and Family Spirit. And then we have one promising practice, which is our Arizona's own Health Start program. We work directly with Maricopa County Public Health, Pima County Public Health, First Things First, Department of Child Safety, and the Navajo Nation. And we also work directly with some tribes, which include San Carlos, Apache, Cocopa, Gila River, Hualapai, and the Navajo Nation. And in 2019, McVie served 2,325 families in at-risk communities through 23,241 home visits. Next slide. So this is a snapshot of children and youth with special healthcare needs. And what I really wanted to highlight here, once again, is when you were looking at children experiencing adverse childhood events, you can see there that children with special and youth with special healthcare needs are at a significantly higher rate than children without special healthcare needs. And then we also know that children and youth with special healthcare needs consistently have insurance throughout the past year. They have a high number. And then we also know that we have some work to do in helping children with and youth with special healthcare needs to obtain a medical home. Next slide. So really what I wanted to highlight here with this slide is we are really leveraging the experiences that we've had with family and youth engagement. We're very fortunate to have two amazing family advisors that are part of our team, and you'll get to hear from them a little bit tomorrow. But we really want to leverage those experiences and apply those opportunities to all of the population domains that we have here in Arizona. And then we also do provide a significant amount of direct service. This is probably where we provide the most direct service through gap filling opportunities, addressing cystic fibrosis, supporting metabolic formula for children and infants and children that have special needs. We have a medical services project assisting with engaging and enhancing medical homes. We provide direct support to Ryan House and Ronald McDonald House for respite services for families in need. Next slide. Oh, can you back up one, Meg? Thank you. This is a snapshot of adolescent health. And really what I wanted to highlight here is that the three leading causes of adolescent mortality are accidents, intentional self-harm, and homicide, which are all preventable. And then the other thing that I wanted to hone in on is when you look at the disparities between male and female, you can see there that we have higher rates of bullying, for example, among males in Arizona. And I'm hoping that Jessica will cover some of these elements tomorrow or later today. But what I also wanted to highlight with regards to the top leading causes of death in Arizona among adolescents is that Native American adolescents in Arizona are 3 times more likely to die than white adolescents. So those are very tragic statistics, but we are hoping to continue to address these issues, and I'll talk a little bit about them a little bit further down. This next slide is really kind of a, plus and minus present slide, because it really does show that Arizona has done a great work on reducing teen pregnancy over the course of time. You can see there that we've been steadily going down. But when we take a closer look at the data, we see that there continues to be significant disparities among the different ethnic minority populations. Next slide. So very quickly, our adolescent health initiatives, we do utilize maternal and child health funding for these. We also leverage our state lottery dollars, and we have a huge effort going on related to bullying prevention and making sure that resources are available for schools, for school administrators, for parents, and for children as well. Next slide. Just want to touch very quickly on oral health. Oral health is one of those strategies that really anchors all of the work that we do in our bureau. And the oral health services that we provide are a crucial way to connect low-income students with oral health care and education. This program has severely been impacted by COVID-19. Thousands of low-income children are not receiving their basic prevention services. And we really are looking forward to being able to get back into the schools. I'm going to turn it over to Martin with this next slide. I'm going to turn it over to Martin, where he's going to talk to us a little bit about what we've learned through our Title V needs assessment.
Hi, thank you, Patricia. Good morning, everybody. So I won't go too much into the data because Patricia did an amazing job of doing that already. So we'll just go right into the next slide. Just to let you all know that there was this big needs assessment that happened. You may have been involved, you may have heard of it, but our needs assessment is very comprehensive with 7 different methodologies, and those you see there on the screen. I'm not going to go into the different types of it. Just know that it was a very diverse and comprehensive needs assessment with various types of data sources, types of data, qualitative, quantitative, primary, secondary data, stakeholders, and geography. We have pretty good geographic spread across the state to ensure that we hear from all the voices in our state, especially those that are hard to reach. Next slide, please. Okay, one of the things that we're very proud of is that for the first time, our Title V program wanted to engage the tribes in doing their own maternal and child health needs assessments. So through partnership with the Navajo Department of Health and Diné College and the Intertribal Council of Arizona's Tribal Epicenter, we actually worked with them for them to establish their own maternal and child health needs assessments for their communities, Navajo for Navajo, and then ITCA for the other 21 tribes that they represent. So all of these reports are available on our website. In fact, I'm just going to throw in the link in there because it captures all that additional detail that folks may want to know regarding a needs assessment. But we're very proud of this collaboration with our two partners here. Next slide, please. Just to let you know that on the left, on the column, is a list of all the different maternal and child health indicators that we considered as part of the needs assessment. This is a risk profile, essentially. And so what we did is we compared Arizona's rate to the national rate. And anything in the blue, because of course I'm a Wildcat, so it's all about red and blue. Anything on the right is, and I know I'm saying that in ASU realm, so I'm being careful. So on the right is also all those things that are like where Arizona scored favorably. Oh, I see that. And then on the left are all of those in the red, all of the things where Arizona did not favor as well and compared to the nation. So you'll see that for those that are in red, those were the indicators that we wanted to focus on and really dive into disparities and what are the different groups that are being impacted for those indicators. Those blue ones are important, but we really wanted to focus on these red ones to kind of start making some more progress in Arizona. Next slide. And at the end of the day, we end up coming with these kind of needs for services. This is from our public health survey, public survey data, excuse me, where we asked folks to let us know the types of services that they needed by each of those populations and the reason for why they were not able to get them. But here is a quick snap for women's health. There is definitely a big need for chronic disease management, breastfeeding education, dental care, counseling, stress management, dietitian. And so you'll see the different types of services there. And so we're very confident that this captures a good understanding of what the service needs continue to be. Overall, an underlying undercurrent to all of our needs for our populations is access to care, but also adequacy of care as well. It's not just about access, but whether they're actually accessing what they need for their own benefit and condition, and of course, insurance coverage. So access is very well complex, but that was the undercurrent throughout all of these needs. So next slide, please.
Martine, we're really running out of time.
And so I got you. So then pretty much this was the main thing for barriers to care was affordability, availability, and lack of other support services across all the different populations, including adolescents, because we have a unique space for them. Next slide, please. And so just to point you out, I just put in the link that our needs assessment report is there and it's in the chat box. I think Patercia has the last final of slides there. So I'm going to just pass it on back to her. Thank you.
Thank you both, Patricia and Martine. We obviously there's a lot of interest in this, and we're so grateful for all of the work that you do to sort of provide that backbone support for MCH in the state. There were a couple of questions in the chat, but I don't think we have time to answer them verbally, but if you could type your responses, that would be really great.
Meg, this is Patricia. I wonder if you could just advance the last slide and I can conclude here. I just want to make sure that everyone knows that as a result of our Title V needs assessment that Martine just went through very quickly, we were able to establish our 2021 through 2025 statewide maternal and child health priorities for the state. We will share our PowerPoint with our attendees today, but just wanted to let you know that we do have these new priorities going forward for each of our population domains listed there on the left. And again, these are anchored with a lens on health equity and family engagement that we are driving throughout each of the population domains. And then on the far right, you see the national performance metrics that we need to report on annually for each of these population domains. I want to thank you so much, Meg. And last year, when I got started, if we had, you know, a month, we might get through most of everything that's related to maternal and child health. So thank you so much.
Thank you. It was a really great talk, and I think there's a lot of interest in the work and a lot of folks that want to contribute.